Gout, a painful form of arthritis caused by the buildup of uric acid crystals in the joint, is a condition that many people are all too familiar with. The sudden and severe pain, swelling, and redness that typically affects the big toe joint can be incredibly debilitating, making it difficult to go about your daily activities. I'm Houston podiatrist Dr. Andrew Schneider. I'm board certified with over 20 years of experience. While gout is a relatively well-known condition, there are several other ailments that can present similar symptoms, making it challenging to pinpoint the exact cause of your joint pain. In today's video, we'll explore the various conditions that can be mistaken for gout, including pseudogout, osteoarthritis, rheumatoid arthritis, bursitis, tendonitis, infections, and injuries. By understanding the differences between these conditions and their symptoms, you can better communicate with your physician and ensure that you receive the appropriate treatment for your specific ailment. Before I get into it, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Sometimes your joints can feel painful and swollen. There are different reasons why this can happen. Gout is certainly one of them. Let's learn about some more. One condition is called pseudogout, and that can make your joints hurt. It's similar to gout, but it's caused by different things. Pseudogout happens when crystals called calcium pyrophosphate form in the joints. These crystals can cause inflammation and make your joints feel like they have arthritis. Pseudogout mostly affects bigger joints like knees, wrists, and ankles. It can also make your joints stiff and swollen, just like gout. But remember, gout happens because of uric acid crystals, while pseudogout happens because of calcium pyrophosphate crystals. To find out if it's pseudogout, we can do some tests. I might take a little bit of fluid from the joint and send it to the lab to be looked at under a microscope. This will help us see if there's any calcium pyrophosphate crystals in the fluid. I might also do some imaging tests like x-rays or CT scans to see the joint better. If it's pseudogout, I can give you medication to help with the pain and inflammation. I might give you an anti-inflammatory medication, or steroid, or a special medicine called colchicine. I might also suggest lifestyle changes and physical therapy to make your joints work better and stop future flare-ups. Sometimes it can be hard to tell the difference between osteoarthritis and gout. Osteoarthritis happens when the cartilage in your joint wears down and your bones rub against each other. It can make the joints hurt, get stiff, and swell just like gout. But the causes are different. Gout happens because of too much uric acid, while osteoarthritis comes from wear and tear to the joint over time. To figure out if it's osteoarthritis or gout, you need to think about which joints are affected, how the pain started, and your risk factors. Osteoarthritis often affects big joints like knees, hips, and the spine. Gout usually targets the big toe, ankles, and the knees. The pain from osteoarthritis happens slowly and gets worse over time, while gout pain can come on suddenly and be really bad. Risk factors for osteoarthritis include getting older, being overweight, joint injuries, and genetics. Gout is more connected to our diet, alcohol consumption, certain medications, and kidney problems. A doctor can help by looking at your symptoms, your medical history, and maybe doing some tests like imaging or blood tests. It's important to know about rheumatoid arthritis too, because it also can be confused with gout. Rheumatoid arthritis is when your immune system mistakenly attacks your own joints, causing pain and swelling. It may affect many joints on both sides of the body, unlike gout, which usually affects only one joint. Rheumatoid arthritis can make you feel tired, have a fever, or lose weight, which are also not common with gout. To tell if you have rheumatoid arthritis or gout, we need to think about how the pain starts and where it happens. Gout pain comes suddenly and is really bad. Rheumatoid arthritis pain starts more slowly, and you may feel stiff in the morning for more than an hour. Gout usually affects the big toe joint, while rheumatoid arthritis targets smaller joints in your hands and your feet. Blood tests and imaging can also help me find out if you have rheumatoid arthritis. I look for things that show inflammation and damage to your joints. By knowing the difference, I can make sure that you get the right treatment for the joint pain. Two other things that can cause joint pain and swelling are bursitis and tendonitis. Bursitis happens when small sacs called bursae get inflamed and cause pain. Tendonitis is when the tendons that attach muscles to bone get irritated or swollen. To tell them apart, we need to think about where the pain is and what makes it worse. Bursitis usually happens in big joints like the shoulder, hip, or elbow or knee. The pain gets worse when we move, and there might be redness or swelling associated. Tendonitis can happen in different places like the elbow, the wrist, the shoulder, the knee, or your Achilles tendon coming to the back of your heel. The pain is usually a dull ache that gets worse when we move the joint or put strain on the tendon. Rest, ice, compression, and anti-inflammatory medication can help both bursitis and tendonitis. But if the pain doesn't go away or gets worse, it's important to come and see a doctor for the right diagnosis and treatment. Sometimes infections or injuries can cause joint pain too. One infection called septic arthritis is like gout but caused by bacteria in the joint. Injuries can make your joints hurt and swell too. If you have an infection or an injury, you need different treatment than you would for gout. Infections need antibiotics, and injuries might need rest, ice, compression, elevation, or physical therapy. It's important to know what's causing your joint pain so we can get you the right help. Understanding the different causes helps me give you the right treatment. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're experiencing severe joint pain, it's vital that you come in to get it checked. We'll get an accurate diagnosis and appropriate treatment. Don't let the pain and discomfort derail your life. Get it checked out and find relief sooner rather than later. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.